Hello, everybody, and welcome back to my YouTube channel. I am Dr. Dweepika and I am here to make your life simple by teaching you everything about orthodontics. Okay, so yes, before we start with the test series, third part, I want you people to go back and read and study and rather watch my YouTube videos on COVID. Okay, there is one video which is purely based on COVID. There is one video even on mucormycosis. I want you people to be thorough with those two videos because yes, do expect questions from COVID in this particular examination. Yes, COVID has been added to your syllabus, which is very obvious. So you should be very much thorough with it. And new guidelines, new rules are coming up almost every day, and there is something or the other which is changing. But yes, COVID video has been uploaded, and I want you people to go and watch it. Right, and I hope you have attempted the first two parts of test series and you have scored yourself. Also, what you can do is after a span of 10 to 15 days, go back to the previous two test series and re-attempt them so that you stay in constant touch with the subject. Again, if there is any other topic which you people want me to cover up first, please write down in the comment section below. It would definitely be addressed because the few topics which have been uploaded were purely based on students' demand. So yes, I am here for you people to help you people sail through the examinations and clear the examinations at the very first go. So yes, do as directed and tell me the topics which are to be covered. I'm here sitting for you people to make YouTube videos so that it is of help to you. Okay, so today we would be covering the third series. Okay, third series is purely based on orthodontics, obviously, and most of the topics have been covered earlier. The topics which are new is basically I'm making a little background so that we can start with those topics. Okay. So yes, general guidelines, general rules first. 240 questions in the exams. Correct response 4 marks. Incorrect response minus 1 mark. Unattempted is 0. I am sure you people are thorough with this. Again, the latest advancements, image-based questions and patient-based questions. Just to remind you, 3 videos on image-based questions are already up on my YouTube channel. Kindly go back and attempt those questions. The very first question for today's series. Serial extraction is contraindicated in all of the following except, meaning among the 4 situations, there is one situation in which you can do serial extraction. Now let us see. Can you do serial extractions in open bite cases? No, you cannot. In spaced dentition, not required because there is enough spacing. Flaring of teeth, definitely. And anodontia, why would you extract? Okay, from where will you extract? Okay, so the correct answer is flaring of teeth. So the correct option for answer A is option number C. A patient is involved in chronic mouth breathing. The clinical examination of patient reveals. So yes, this question is taken from the topic of habits, which is very important from both orthodontic and periodontic point of view. You all should know that mouth breathing is like synonymous with a classic sign of adenoid faces. And adenoid faces are characterized by convex profile and long face. I don't think we need to discuss much on it because this is a very common thing. All of you must be knowing that in patients with chronic mouth breathing, they have a long face syndrome, which is also known as adenoid face. And this is the typical picture of an adenoid face where you can see the patient's profile is convex and there is a long face. Okay? So, patient involved in mouth breathing will have a convex profile and long face. So, the correct answer is option A. Moving on to the third question. Cartilage differs from bone in that it grows by. So, cartilage differs from bone is that it grows by interstitial growth pattern. We know that there are two kinds of growth pattern, appositional and interstitial. Okay, so this is a part of your growth and development in orthodontics. So yes, cartilage will differ, that is it grows by interstitial growth pattern. Okay. I hope you people have a pen and paper with you. You are marking yourself along with me, and I hope you have got all the questions correct till now. Moving on. The extraction of upper first molar may be indicated. They are talking about extraction of molar, which is a very critical decision which have to be taken. It may be indicated when the removal of 4-4 provides insufficient space, when they are rotated, when their prognosis is poor, or when 5-5 are palatally placed. Okay, now let us go by elimination system. If my upper first molars are rotated, I will not extract them. I will correct the rotation. So this is cancelled. And when I'm already extracting upper first premolar on both the sides and still the space is insufficient, I will not extract first molar. What I can do is I can distalize. Okay, that is one option. Next, I can go for interproximal reduction. Okay, so these are the two options which we generally do if we have insufficient space in spite of what? Extracting the two first premolars. So this is again ruled out. The next option which we have is when 5-5 are palatally placed. If 5-5 is palatally placed, why do we need to extract the first molar? We can always bring it into the occlusion. Okay, and if the space is insufficient or something, we never consider extracting the upper first molars. They are the permanent tooth which have such an important role in mastication. So they are only extracted if their prognosis is poor. Okay, so the absolute indication of extraction of upper first molar is when they have poor prognosis. So the correct option is answer C. Moving on to the next question. Which of the following appliance is not used for slow maxillary expansion? So I'm sure students, if you have gone through the previous video, you have heard the terminologies like slow expansion and rapid expansion. So which is not used for slow expansion is my Hyrax appliance. We have seen how does an Hyrax appliance look in the previous videos. Okay, we have seen coffin spring also, we have seen quad helix. I don't think we have seen quad helix, I'll show you the diagram of quad helix. But coffin spring we have seen previously and Hyrax we have seen previously and jack screw everybody knows. Okay, so these three things are for slow expansion and Hyrax is used for rapid palatal expansion. RPE is a very important topic in orthodontics and we have a separate textbook on it. I have mentioned the name of the textbook in my previous videos. So again, students, you need to go back to my channel, subscribe to the channel so that you get notified whenever I'm uploading a video. Okay, and go through all the previous videos so that you can form a link. Linking is something which is very important. Okay. Next question. Yes, so the correct option is answer D. Option D is correct. Moving on to the next question. Quad helix. It widens the upper arch. It is used in cleft lip, retracts the upper canine, or it is a bite opening device. So by now, all of you know that quad helix is used for expansion or widening of upper arch. Okay. If the option would have been it is used in cleft palate, then also we would have considered that option because in cases of cleft palate, we do expand the maxilla. Okay, but other three options makes absolutely no sense when it comes to quad helix because it is an expanding device. Okay, so the correct option is option A. I hope these three MCQs are clear to you. With that concept, moving on to the next question which we have. Okay, yes. Before that, this is quad helix as we were talking about. See, there are four helices. 1, 2, 3, 4. So this becomes your quad helix. In case these two helix are missing and we have just these two front helices, it becomes a bihelix. Quad helix, bihelix. Okay, this is coffin spring. Everybody knows this is a coffin spring. We have even discussed this earlier. And this is our quad, Hyrax appliance. Right? Let me erase this. This is my Hyrax appliance. And in the middle, what you have is a jack screw. So yes, we have this jack screw assembly in between. This is Hyrax appliance which can be either bonded or it can be banded. Right, and this is used for rapid palatal expansion. Yes, next question. Cement which is used for cementation of orthodontic bracket is. The correct answer, I am sure people know it. I have purposely not marked it so that there are few questions which you can attempt on your own. Okay, sometimes it becomes a little this thing where that it is already highlighted. Okay, you don't want the highlight to be done. So yes, in few questions I have skipped it. I have not highlighted so that you people can do it yourself. So the correct answer is composite. We bond the orthodontic bracket by using composite, and the procedure is known as bonding procedure. So what you do is we take a reverse action tweezer, hold the bracket, place the composite and place it onto the tooth surface. And now what is happening in this photograph is all the excess composite is being removed. Before we cure the bracket, before we cure the composite, okay, we have to remove all the excess composite which is present around the tooth surface. So this is what is going on, and all the excess composite is being removed, and then we will cure it using our LED light. Why do we need to remove all the composite which is extra? To make sure the oral hygiene is maintained well. Otherwise, that area becomes plaque accumulation point and it leads to poor oral hygiene. Okay? So yes, the cement used for cementation of orthodontic bracket is my composite resin. Okay. Moving on. The next question which we have is, edge-wise appliances are used with. Now see, orthodontics has a history. It has evolutionized a lot. So earlier we had edge-wise bracket. Then we had pre-adjusted edge-wise bracket. Okay, then introduced was our MBT system by McLaughlin, Bennett and Trevesi. Okay, so there has been generations of orthodontic brackets, wires, and even the mechanisms and biomechanics. So edgewise is a very old biomechanics which was used. And edgewise appliances are used along with rectangular arch wires. Okay, they are used on incisal edge of anterior teeth. No, if it is purely on the incisal edge, it will lead to tipping. They are used with labial arch at incisal and gingival arch at each bracket. No. They are used to obtain edge-to-edge occlusion. No. The correct answer is they are used with correct rectangular arch wires. Okay. Moving on to the next question. Students, this is one important question, so kindly highlight it. Okay. In examining a child patient, normal gingiva is diagnosed on basis of following, except. Okay, so when you're diagnosing a child's gingiva, you will see the following features minus one thing. Now let us see what. Is it contour, stripling, sulcus depth, or is it the depth of vestibule? So the correct answer is depth of vestibule. We will always check for contour. Okay, contour is one thing which is always checked whether the child patient is there or we have an adult. Stripling is the feature of child's gingiva. Sulcus depth is checked to make sure there is no bleeding or probing or anything, right? So the correct answer is depth of vestibule. So in this figure, you can see how the depth of vestibule is being measured. At the deepest point of the vestibule, one probe is placed, and from that we have a periodontal probe coming up which is measuring the depth of vestibule. So this becomes my depth of vestibule. So this is one thing which is not checked in all the patients. Okay, so this does not form the basis of our diagnosis, whereas checking contour, stripling and sulcus depth is a part of normal diagnostic thing. Okay, so this was our question whose option D is the correct answer. So yes, students, again we are done with the third test series. I hope you have attempted all the questions, you have marked yourself, and now you know where exactly you are standing. You know, at this point of time, it is very important that you start getting more than 7 out of 10. You start getting more than 7 in each and every MCQ. What you people can do is write down the set of questions which you got incorrect. Okay? So what you can do, test series 1, my questions 7 and 8 were wrong. In test series 2, my third and fourth question were incorrect, suppose. Okay, so once you are done with that, you go back to my YouTube channel. Okay, open the first test series, second test series and start re-attempting those questions. I cannot emphasize enough the importance of revision. Okay, doing revision is very important, whether it is of your coursing or whether it is of MCQs. So yes, students, keep revising. I hope you all have purchased Pulse, Gauri Shankar, Bhatia, because all these textbooks are very important to be read and they are very good textbooks, okay? So all the MCQs given in those books have to be done by you for at least 2 to 3 times. only then you can, recapitulate, and then you can make form links, and you can, have some idea, logic behind what is being asked in the question. Of course, reading the theory is of primary importance, and that is why I have uploaded video lectures for you people. But attempting at least 500 MCQ daily is also very important. Okay, so that is how you have to schedule your time in such a manner so that you are able to attempt 500 MCQs daily, right? Whether it is revision or whether these are fresh set of MCQs, that is okay. Just do 500 MCQs daily and keep a tab on my YouTube channel. So with that, please study and stay tuned because there is way more things to come. Okay, students? So thank you so much and all the very best.